Hi, guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 22-year-old sexually active female presents with a complaint of a painful and burning sensation during urination and vaginal discharge that appears yellow and green in color. Upon examination, there is noted strawberry cervix and a yellow green frothy discharge. What is the most likely diagnosis? Is it A, chlamydia, B, gonorrhea, C, trick, or D, candidiasis? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, what is the most likely diagnosis? And I always tell y'all, if they're looking for a diagnosis, you need to run it back and look at the assessment findings so you know what you're dealing with. So when you're thinking about assessment, think of how they present. What are their signs and symptoms? What are their chief complaints? What do you see on exam? Visualize this person in the office with you so that you're able to fully think of all the steps and things that you identify when you are actively doing it. Because commonly, we're so used to just doing assessment. Like as soon as you encounter somebody, we're already assessing. So sometimes I think that y'all kind of scratch that off and don't consider all of the steps or the things that fall into that category because it's just second nature. But here, this is a 22-year-old female. She is sexually active. She's complaining of pain, burning sensation with urination, yellow green discharge. And then on exam, the nurse practitioner notes a strawberry cervix and yellow green discharge. Now, I always say make sure you know your key identifiers. Brittany's brilliance. I say, when I say this, you say that. So when I say strawberry cervix, you should say trichomonas. So the best answer is C, trick. All right, question number two. A 30-year-old female on combined oral contraceptive pills missed a pill in the middle of her cycle. She is concerned about potential pregnancy. Which of the following is the most appropriate next step? Is it A, take the missed pill now and take today's dose later this evening, then continue taking the pills as scheduled and use additional contraceptive for the next 7 days? B, take a home pregnancy test immediately. C, discontinue the pills and wait until the next menstrual cycle. Or D, um, don't worry about the one missed dose. Skip it and continue with the remainder of the pill pack. Take a moment and tell me what you think. All right, so stem of the question here, which of the following is the most appropriate next step? So, all right, so what do we have going on? This 30-year-old female has missed one of her birth control pills in the middle of her cycle, and she's concerned about pregnancy and looking for recommendations. One missed pill is okay. So, you want to A, tell them to take the missed pill now as soon as she remembers. And then later this evening, typically in a 12-hour span, take that day's dose and she'll be back on track after that. Also, to use additional contraceptive for the next week to prevent any mishap, right? So, always, if they have missed one or two consecutive pills, they can catch up. If they miss three or more, then that's when we need to discontinue and wait until the next cycle to restart a new pill pack, okay? And then lastly, question number three, a 45-year-old male presents with knee pain following an acute injury while playing basketball. He reports feeling a pop at the time of injury, followed by pain, swelling, and difficulty with range of motion. Physical exam reveals joint line tenderness and a positive McMurray's test. Based on these findings, how should the nurse practitioner diagnose? Is it A, bursitis, B, a torn ACL, C, a meniscal tear, or D, arthritis? Take a moment and tell me what you got. All right, stem of the question here states, based on these findings, how should the nurse practitioner diagnose? So again, since we're looking for a diagnosis, you want to run it back and look at those assessment findings. This is a 45-year-old male is complaining of knee pain after an injury playing basketball. He heard a pop. There is pain, swelling, difficulty with range of motion. There is joint line tenderness on exam. And then here's your key identifier. The McMurray's test is positive. So I want you to think about, what is the McMurray's test? If it is positive, what are we thinking? You should think C, meniscal tear. McMurray meniscus, right? So your best answer is C. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Now, the things that I do offer are my review book. You can get it in a paperback or ebook option. They're both linked in the bio of this channel. You can get the self-paced review if you prefer to study independently. That's also linked in the bio of this channel. If you're looking to do any practice questions, my QBank options are linked in the bio of this channel. And then lastly, if you're looking to book any of my one-on-one sessions, I always say either call, text, or email us, as I offer a variety of one-on-one session types. So I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.